But the contest to replace the term-limited GOP Governor John Kasich went to Republicans again, along with the state's 4 down-ticket races, and Republicans maintained their lead in Ohio's U.S. House delegation. Joining us now is the newly elected governor of Ohio, the state's current Attorney General and former U.S. Senator Republican Mike DeWine. Good to have you on board this morning, and congratulations.
Well, good morning. Thank you very much.
Well, Senator, we want to ask you to be political analyst because that's not why you're here. But my gosh, Ohio certainly is looking red top to bottom for the first time in a long time. It's considered one of the key swing states. What do you think? What's made the difference? Why did Republicans avert the blue wave that swept through a lot of the industrial northeast? Did Kasich and other Republicans do a pretty darn good job over the past 8 years?
I think the answer to that is yes. And I think also, the president's tax cut has helped the economy. Our economy is moving forward. We're obviously, you always can do better. And, we're going to focus a lot on children's issues and getting kids ready for kindergarten because ultimately that has a huge impact on their ability to, live the American dream. We're going to focus on the drug problem. So things are not perfect in Ohio, but I think that, people feel Ohio's headed in the right direction. Ohio is headed in the right direction, and my goal as governor will be to build upon what the governor and the legislature have done so far.
And what was your message on health care? What's your plan for Ohio's health care? Obviously, the top issue in America right now, and a lot of Americans seem to be in suspended animation because Republicans talked about getting rid of the Affordable Care Act, but a real solution, at least coming from Washington, seems to be what's just not forthcoming.
Well, the Democrats in this race spent about at least $10 million attacking me, claiming that I would not, mandate that insurance companies cover pre-existing illness. I told them that was absurd. As someone with 8 kids and 23 grandkids, my family understands medical problems like most families do. So, that's simply not true. My commitment has been that if the federal law for some reason is in fact changed, that we'll step in Ohio and do what we need to do to make sure those folks are covered. Proactively, though, what we're going to put a lot of focus on with first starting with our state employees and then moving to our adult Medicaid population is wellness. We think that there's great models out there. The Cleveland Clinic, for example, has a great model they've done with their employees where they've not taken things away from them but given them incentives to hit certain marks. It's stabilized the cost of medical care, and it's made for a much healthier workforce.
Yeah, that sounds fantastic.
We're going to focus on that a lot.
Prevention is really important, but just bottom line, does every resident in the state of Ohio have a right to health care?
Well, we want every resident to have health care. We certainly do, and we're going to do what we can in regard to that. Medicaid expansion, we are continuing Medicaid expansion, or will continue when I'm governor of the state. We're going to have a wellness component with that, and we think that will make a big difference.
Governor-elect, it's Willie Geist. Just to follow up on that, you've talked about the Medicaid expansion signed and started by Governor Kasich, and you said we're going to keep it, but it's unsustainable. So how do you square those two things? How do you make that Medicaid expansion that covers some 700,000 people in your state sustainable? What do you change about it?
Well, we haven't said it's unsustainable. What we've said is it may be unsustainable. I mean, what happens in 2 years or 4 years if the federal government decides not to be paying over 90% of that and drops it back to what the federal government is paying for other Medicaid people?
So how do you change that?
Look, you work towards the wellness component. You try to help people. One of the things that I have seen because of the drug problem and my work in regard to the drug problem that's been very positive with Medicaid expansion is the coverage of people who are coming out of jail. We have sheriffs who are signing people up right for Medicaid as they're coming out so they can get into treatment. So our goal is to get people off Medicaid by getting them into treatment, and so they can get off the bench and get in the game, and that's really what the goal is.
Would you be willing to freeze enrollment in that program, as some Republicans in your state have suggested?
I'm not, we're not to that point at all. That's not our plan.
I just want to clarify, you said you want everyone to be covered, but do you believe that everybody in your state has the right to health insurance?
Look, we want everybody to be covered.
That's a different answer, though. I'm just Do you believe they have the right to...
we can talk about rights or not. Look, my goal as the governor of the state is to make things better for the people of the state of Ohio and to work with them. We have to have an economy that's moving forward. We have to make sure that people are covered for pre-existing illnesses. We're going to put a lot of emphasis on infant mortality, for example. We're going to be very aggressive. We're going to triple the size of the program of home visits for pregnant at-risk moms. I mean, these are very tangible things that the DeWine Houston administration is going to do, and we're fired up about it and ready to go.
Well, Senator, I know that health care was the top issue in Ohio and across the nation. What do you see, though, other than health care, as Ohio's top challenge? And we'll play this tape for you in 4 years or 8 years and play it back for you. What do you want to see in 8 years progress the most?
I think we have to reach young kids who are at risk. I think that's the biggest determination of where we're going to go in the next decade, is how we reach those kids. We also have to really focus on this drug epidemic. We're going to put a lot of emphasis on prevention, K through 12. We're going to do something that I'm not sure any other state's doing, and that is K through 12, every grade, every kid. We're going to have something in regard to prevention every single year. If you do that every year for 13 years, we think the data clearly shows that you're going to have a much healthier population, and fewer kids are going to go down the path of addiction.
All right, Ohio Governor-elect Mike DeWine, thank you. I've talked to a lot of governors who became senators. They didn't really like that switch. I've talked to a lot of senators who became governors, and they felt like they could do a whole lot more. Good luck. I hope you get that opportunity, and thank you for being with us. Great to see you again.
Enjoyed it. Thank you very much.